It's Jenny D and Health Tidbits with Dr. Kohli, of course, from 9 News. You can check her out there. Also, Cherry Creek Heart in Aurora is her practice. Very good to have you come on with these because there's some new controversial mammogram guidelines. And you know, this is something that's really close to my heart.
Yeah.
So tell us about these new guidelines and why not all experts are kind of on board for it.
You know, I was shocked to see these guidelines. So we have the American College of Radiology, which is the guidelines we had been going off of that most of us know. Starting at the age of 40, you get a mammogram every year and you kind of continue basically until your doctor tells you otherwise. That's what we had been living off of. Then all of a sudden, the American College of Physicians, which are sort of the primary care doctors, not the radiologists, the imaging doctors, released these new guidelines that knocked everybody's socks off because they say, okay, start screening at 50, not 40. They say screen every 2 years between 50 and 74, right? Instead of every year. And then at 75, well, your risk of dying is so high, you can probably stop screening. And between 40 and 50, unless you're high risk, you don't need to screen. And even if you do screen, it's every 2 years. So we've gone from screening everyone at 40 every year to screening very few people in the 40s, starting at 50, and then again every 2 years, knowing that breast cancer in 2 years can grow pretty quickly.
Oh, yeah.
And knowing that we're seeing a surge in young
I was going to say, we've talked about the young breast cancer being a thing. And so why is this study, like, why the change? Like, I don't understand why they think that this is a good idea.
So the American College of Physicians says that they believe that there is too much overdiagnosis and too much false positives. So, you know, there's obviously risk balances to everything. The advantage of screening people more aggressively, you find younger onset breast cancer, you find it earlier, it can be potentially curative. The disadvantage is that you could find false positives, you could find, you know, tumors that aren't breast cancer, you could have to have more biopsies, have more follow-up tests. So they call that overdiagnosis or sort of false positive rate being higher. So they're saying that based on their review of the literature, if you find a breast cancer in your 40s, it makes a very small impact on your risk of dying. Now, my problem with that is that it's old data, right?
Yeah.
And we're talking about breast cancers many years ago and the risk of dying. Now we know we're seeing more breast cancers. We know we're exposed to more potential carcinogens in our environment.
Yeah.
And you're really confusing women.
Yeah.
Right? So you as the average woman, well, what are you supposed to do? Because you've got one group of experts saying 40 every year. You got another group of experts saying don't start till 50 and then do it every 2 years. So what are you left to do?
Well, and then some people, it's like, do you even know if you're average or high risk? Like, these are certain things that if you don't know, you go in at 40 and you catch it early, you have a better chance to like you said, to cure it.
Yeah.
Other than, you know, waiting. I just feel like it's kind of like I would rather save one life by having the 40 than I would, you know, like. And that's
I think
scary thing.
You bring up a good point, which is how do you know your risk? So there are these online calculators and actually want women in their 20s to start to put their numbers in and calculate their risk. And the risk evolves over time. So that every 20-year-old woman who goes to a gynecologist should know exactly whether she's average risk or whether she's high risk. Okay. Now, the point you're making is that even the average risk women now who don't have a family history, who don't have a lot of risk factors, are somehow ending up with breast cancer in their 40s. In fact, my cousin's wife, she has stage 3 inflammatory breast cancer, no risk factors at all. And she had it in her 30s. You know, so I agree with you, Jenny. I think that screening people earlier, and if you're not sure which one you should do, talk to your doctor, as always, but I would err on the side of being more conservative until we have more modern data really guiding our practices, knowing that you might be paying the price of a false positive or an unnecessary biopsy. But I think most women would say if it means finding their cancer early and curing it, that might be a risk they're willing to accept.
Well, and this is a hard thing that I went through personally, too, because I do have dense breasts. And so that's another thing I think that is a big conversation point to have with your doctor. And because that was one of the things that I ended up going in early because I had high risk.
Yeah.
And then, but it was the dense breast thing. And they were like, that's a big deal. Here's how, you know, and how does that affect them?
Yeah. So dense breast, that's 50% of us that have dense breasts. And you don't know if you have dense breasts, to your point, until you get a mammogram, right? Because you can be skinny, you can be overweight, you can have small breasts, large breasts. It doesn't matter. The breast density is a whole different factor. And breast density does two things. Number one, it increases your risk for cancer. Number two, it makes the mammogram less diagnostic. So you got white on white. You're looking for a white tumor on a white background, which makes, even with all the fancy AI tools and everything, really, really hard to detect. So the American College of Radiology guidelines and the Breast Society imaging guidelines say that if you have dense breasts, you need a second screening test, either an ultrasound or an MRI, depending on your underlying risk factor, to really make sure. And usually what they do is they alternate. So if you're getting the mammogram in January, you'll get that second test in the summer, in June. So every 6 months you're getting checked to make sure you're not missing the cancer. And I think to that end, it's really important for a woman to know her breast density, because most of us don't know our breast density.
Until you go in, and then all of a sudden you're like, wait, what?
And then if you don't start getting that mammogram until 50, like these new guidelines are saying, you won't even know till then. So I would say 3 things that every woman must know off of her mammogram. The first is whether or not there's a cancer, obviously, that they put in the bottom. So if you scroll down to the bottom, that'll be in the conclusion section. But read the fine print, because that's where you'll find out the breast density, and that's where you'll find out whether or not you have something called BACs, breast arterial calcifications. So little tiny deposits of calcium in the arteries in the breast, because guess what? That's a heart disease predictor.
Oh, goodness.
So me as a cardiologist, I'm checking women in their 40s. If they're blocking up the tiny little arteries in the breast, they're going to block up the big arteries around the heart 10, 20 years later. So I start to think of those women as particularly high risk for heart disease, and I start screening them more aggressively.
So be your own advocate and use common sense. I would feel like that's the thing. I'm not a doctor, believe me. I'm not a doctor, but I would say the 40 sounds like a way better plan to me. But make sure you check with your doctor. And if you don't have one, Cherry Creek Heart and Aurora, go and see Dr. Kohli, our favorite doctor.
Thank you.